So first of all, it is my great tribute to our master, Dr. Samuel Hahnemann, on his 269th birth anniversary on the World Homeopathic Day. I welcome everyone. So this is the case of the palmoplantar keratoderma. This case I took in my clinic, and this case of a 50 years old female, and it is called as also diffuse hyperkeratotic plaques and fissures involving both palms and soles. Now we can see the image. So this is the case. But when patient came to me, she was suffering from these complaints since long, and she took the local steroids. The general practitioner has given the local steroids. These are the images. We can see it. Okay. And this woman has also received the homeopathic medicines from the other doctors, including me, that is Graphitis, Petroleum, Morgan Pure, Calcira Carb, Lycopodium, Sarsaparilla, Hipersal, Bryonia, Ignatia, X-ray, Sulfur, Pulsatilla. And we can see that some of the remedies which are having the specific, sphere of action, that is dryness of the skin and along with the fissures. Now the case proceed further. Okay, so now I ask the patient that if you want to treat, or if you want the homeopathic medicines for your complaint, then you have to tell me everything about your complaint, as well as everything about the person, how you are as a person. Then he started that, sir, whatever has happened to me, I never forgot a single day. The thoughts in my mind, it goes on and on. And earlier there were the quarrels in my house. I still remember all this, but I never get relaxed of this kind of thoughts. So first my observation is that she is very sad, her eyes are wet, but she doesn't want to show me. He can't even let her tears fall. So this is my first observation. And in spite of having so many problems in life, I have remained saddle. That is, इतनी भी तकलीफ है लेकिन मैं एकदम टफ रही हूँ. I never cry in front of anyone. So even though my mother-in-law and father-in-law died, I decided not to cry. So I didn't cry at all. I became angry. If someone says bad words about me, then I reply accordingly. Sometime, even if I get angry, I don't speak. But if it gets too much, then I shout and tell whatever I want. Then all these things goes on in my mind, and it disturb my sleep. The same thoughts are coming again and again. So what is the important thing in the case is, the patient is having the same thoughts keeps repeating in her mind on and on, and because of this she is not getting the sleep. Sir, even my family members don't know about this, what I have told you. So whatever the sensitive issues for the patient, that she was disturbed by the death of her father-in-law, mother-in-law, but she decided not to cry in these the saddest incidents. And one more thing she told me, so now I have not hide anything from you. I have told everything. Okay, now cure me. Just give me the medicine for this. Whatever the incident happened in my life, I told you. Now cure me. Now everything is done. Give me the medicine, and if there is ointment along with the medicine, then also give me the medicine for that. Okay, so this is the history from the patient. And the other symptoms of the case, I cannot tolerate heat at all. I sweat profusely. I have also the constipation. My throat is very dry, and I have to drink lot of water because of the dryness of the throat. I have also low grade fever when I tired from the work. So these are the other symptoms of the case. So I repertorize the this case, that mind morose sulky with sadness. This is my observation. Mind sadness, weeping, tearful mood, control. So that she, whenever she is talking with me, I observe that her eyes were wet, but the tears not coming out from the eyes. Then the thoughts persistent, mind thoughts persistent about the disagreeable, unpleasant incidents. Then her mind, it goes on the past disagreeable events. Then, sir, I don't hide anything from you. That is the rubric mind secretive. and mind sadness weeping impossible. Sir, I have decided not to cry even though the death of my father-in-law and mother-in-law. Then I have the dryness in the throat, and because of this patient is having the thirst. So I took this rubric, and along with this patient is having the general symptoms, that is perspiration profuse, and also the patient is hot, that is warm, heated, aggravates. So, considering this totality, I prescribe the remedy Natrum. Okay, so first follow up. So what I observe in the first follow up, this patient took the local steroids. Okay, so after receiving the proper dose, the homeopathic similum, that is Natrum, the observation is the smile on the patient. Though the physical symptoms, the fissure and cracks, it got increasing. So because of the suppression, after receiving the dose, the complaints are increasing. Because the all of the suppression because of the local steroid, but the smile on the face, that is the first observation. So the mentally, emotionally, the patient is improving, but because of the suppression at the local level, these things get aggravated. So this is the thing we can see. Also the aggravation at the palm. Then after the 2 months, again this is a thing, but we can see the image on the right side. The large scales, they're getting off from these soles. Even little improvement on his palms, and after 6 months we can see that she is drastically improved. But we can see at the heel area some dead skins are also there. Again we can see the little smile on the face of the patient. Okay, and the palms is very clear. Then after 9 months, this is the case. The dead skin, the callosities, the dryness, it went off. So we can see the palms, it is very clear. And this is the follow-up. We can see the before and after image. So the remedy 10 m, one dose. Why 10 m? Because when the medicine which covers the main aspect, main key features of the case, which is very very peculiar, very very prominent of the case, and patient has received many homeopathic medicines but not getting any kind of relief. But in this case, the mental state is very very prominent. So I prescribe the remedy 10 m, and within the duration of the 1 year and 3 months, this patient has received the 3 doses total. So it requires 3 doses of 10 m to complete the case. And I quote one sentence of the Galen: the physician only is the nature's assistant. Okay, so whatever the knowledge we have received so far in the homeopathy, as we know, the homeopathy is art and science. Okay, so we are the servant of the nature, we are the assistant of the nature, and with the help of the homeopathy, the proper simillimum, we can give proper cure, the perfect cure to the patient, not only at the physical level but also at the mental level. So after receiving this dose, patient get rid of her thoughts. She is improving very well, not only at the physical level but also at the mental level. So thank you everyone. Jai Hanuman, Jai Homeopathy.
Thank you so much, sir. It was really an excellent case and a good documentation kept. So this is one of the important things, especially the youngsters who are attending today. This is the main thing that you have to do further, because many a times we treat cases, multiple cases, but we do not keep any kind of documentation. Sir, you can stop share now. But we do not keep any kind of documentation, and that's where we are lagging behind. That's where we do not have the data or documentation where the results of homeopathy, like how the case was at the earlier stages and how it is now, and that too without getting aid of any allopathic medicines later on when the homeopathic medicines have been started. So any questions to anybody up till now? We have beautiful cases ahead. Many miracles of homeopathy we will witness today. So we have one question from Srinivas sir. The question is, any old symptoms reappeared? Anand sir?
Yes.
So can you please answer if in the case any old symptoms reappeared for the patient?
See, in this case, the old symptoms reappear. That is the she took the steroids. The general practitioner, he has given the local steroids on the soles of the patients, and because of that, the patient has the severe condition before. But after receiving this injection, these complaints got little bit better. But whenever I prescribe this remedy, again we can see in the images. Okay, the skin's complaints starts flare up again and again. Okay, but until and unless it flare up, I don't prescribe the dose. But patient starts improving from the first dose, and after I think 3 to 4 months, I have repeated the dose. So the old symptoms reappears. In this case, I am not seeing the not telling the old symptom reappear, but the symptoms which were suppressed by the allopathic dose. That the suppression got the flare up on the surface, and it goes automatically by the help of the medicine.
Yes. So another question was, sir, you gave Natromute 10 mg dose once in 3 months?
No, I have just prescribed first 10 one dose. So after giving the 10 one dose, the patient starts improving in within 15 days. But the unless and until the medicine effect is exhaust, I don't repeat the dose. Okay, so after 3 months, again some quarrel or something happens in her life. Okay, and again she is having the thoughts again, sir, I'm getting the thoughts, and because of these thoughts, I'm not getting the sleep, and I repeat the dose. Okay, so one dose after 3 months, another dose after 4 months, another dose after 3 to 4 months, like this. So whenever the patients requires the medicine, whenever the effect of the previously prescribed remedy exhaust, then we have to repeat the dose.
Yes, that's excellent. That's actually the truth. And especially for the youngsters, see, all these things are actually the keynotes of, practicing homeopathy in your clinic. So it is not what homeopath feels. This is the right time to prescribe a remedy. But when patient inspires the homeopath, maybe through a typical symptom, a physical symptom or a mental symptom, that should inspire a homeopath to think that the second prescription, I mean the another dose, has to be repeated. Unless and until that has been that indication is not given by the patient, it is always better to keep a watch and wait. Don't repeat the medicine.
Yes, and if our remedy is right, the patients, he herself will told us that after getting your medicine, I am feeling better. I'm getting the normal sleep. Okay, and we explain patient. Okay, after this medicine, you feel relaxed. The thought process that keeps going again your mind. You will get rid of this kind of symptoms, but there is a chances to aggravate your physical complaint. Okay, so from the very beginning, so if after receiving the medicine, if the patient is having this aggravation, then patient herself knows that yes, doctor has told me. Okay, doctor has told me this thing gets aggravated. Okay, so this is the one very important point that we have to mention when we prescribe the remedy.
Yes, that is absolutely true. Taking the patient into confidentiality helps a lot in prescription and in the follow-ups.